Hello, my name is Bea Panetta, and today I will be discussing the creativity in nursing. To begin, we will be going over the topic of the benefits of quality care in nursing. And the three individuals that we will be analyzing today utilize their creativity and knowledge to give back to the community through implementing beneficial health practices. The domain creativity in nursing involves patient care, problem solving, and quality improvement. The three individuals that we will be analyzing today would be Clara Barton, Mary Eliza Mahoney, and Florence Nightingale. To begin, Clara Barton was born on December 25, 1821, and she passed away on April 12, 1912. For her background, her full name is Clarissa Harlow Barton, and she's a female American where she carries English and Scottish descent. She was born on Oxford, Massachusetts of the United States of America, where she grew up on a farm as the last child in a family of 3 girls and 2 boys, as a child of Stephen and Sarah Barton. For her education, she was often homeschooled, taught by her older brothers. And her older brothers also taught her essentials of life, such as tying knots and riding a pony, whereas her mother and sisters taught her how to sew and cook. She also studied at the Liberal Institute of Clinton in New York in 1850. And for 2 years, she founded a school in Bordentown, New Jersey, but she established this and she only taught there as the principal became a man, and she decided to leave to become a first woman to hold as an independent clerkship as a copyist in the United States Patent Office. She was the first woman to be in this sort of position. For 2 years, she also distributed supplies and nursed the wounded in the war. And then in 1881, she also founded the Red Cross, which helped billions of people globally. For her major accomplishments, she is known to found the first free school, which she became the teacher of as well. As mentioned earlier, she also became a copyist, where she was the first woman in this position. She was also named the Angel of the Battlefield. This is derived from the idea that she helped soldiers on the warfield, as she became a head nurse for Benjamin Butler in 1864. She also established and was declared as the president of the Red Cross, which helped supply supplies as well as provide aid for those who were in need. For her war aid achievements, it can be noted that she identified 22,000 male casualties in the Civil War. As well as in World War II, she helped achieve 13 million pints for the blood for the military officials. She also was able to supply aid that was accounted for 300,000 tons. For her creativity, Christine Ardelan emphasizes the idea of women being seen as subordinate in the war setting, and Barton was fearless in order to aid those in need on the battleground. This is essential to note as it mentions the idea of her defying society's expectations and continuing with what she believes in, which is to help those who are wounded. And in 1899, Maine battleship explodes, killing 266 members. Barton dictates a routine for volunteers to assist the wounded through clean practices, demonstrating her dedication and knowledge. This shows the idea that she was able to take leadership and guide a large group of members in order to help those who were wounded. She emphasized on her dedication and ability to problem solve through difficult situations. And starting in 1881, the Red Cross assisted billions of victims through natural disasters, connecting emotionally with the victims by aiding their injuries in an efficient but clean manner. The next person we will be discussing is Mary Eliza Mahoney. She was born on May 7, 1845, and then she passed away on January 4, 1926. She is an African American woman who was born in Dorchester, Boston, Massachusetts. She also had two siblings, where she was the child of Charles and May Jane Mahoney. She passed away in 1926 from breast cancer as well. For her education, she received her knowledge from Phillips School in Boston. She also went to the Professional Graduate School for Nursing in 1878. This was an extremely rigorous path where majority of the students did not graduate due to its difficulty, but she defied the expectations of society by demonstrating she was capable. For her training, she also pursued in private nursing due to the common discrimination during this time period. And in 1908, she co-founded the National Association of Colored Graduate Nurses, also known as the NACGN. In 1909, she was also named the National Chaplain. And for 1 year in 1911, she was named the director of Howard Orphanage Asylum for Black Children in Long Island. And her major accomplishments may include her nursing program graduation, which was at the New England Hospital for Women and Children Training School for Nurses in Boston, Massachusetts, in the year of 1878. She also co-founded the Association of NACGN in 1896, and as mentioned earlier, she was in the director position for the Howard Orphanage Asylum. For her creativity, she was a private nurse. She would be on duty for 24 hours a day and would need to ensure the instructions from the family and physician were executed efficiently. The common responsibilities were to give baths, dress wounds and sores, and administer medicine or leeches. These were common remedies for patients, as leeches were seen for carrying away the bacteria and illnesses, and she had to think creatively on providing the resources and necessities in order to help the health of her patients. Mahoney always cared for her patients, but was often treated like servants rather than trained professionals due to the discrimination. Mary Eliza Mahoney attempted to instill changes in the perspective as an individual as well as an organizational basis. She often saw and treated her patients as family. She cared for them deeply and would often try to discover new remedies that would quickly improve their health. Mahoney also demonstrated that an African American could competently handle and excel in the demands of the field, proving that the only obstacle was society's biased and misinformed perspective of the abilities of African American women and of African Americans as a whole. The final person we will be discussing today is Florence Nightingale, and she was born on May 12, 1820, and she passed away on August 13 of 1910. She was an English woman. She was born in Florence, Italy, and only had one sister. She was the child of William and Fanny Nightingale. It is noted that she was also fluent in French, Italian, German, and Turkish. This provided her the ability to be able to converse with her patient in a variety of languages in order to essentially deliver the necessity of providing the details and procedures that are needed to improve their health. For her education, her father often taught her philosophy and modern languages. She also often studied the history of hospitals. It was not common to be going to school at this time for women, but she was able to go to the Kaiserswerth Nursing School in Germany, where she experienced her training for nursing as well. In 1850, she secured a job at Kaiserswerth as a nurse, and in 1853, she was appointed superintendent of a charitable nursing home called a sanitarium for sick governesses, run by a committee of fine ladies. This was an area where it provided a safe environment just for women. And in 1853, during the Crimean War, her services were requested. And in 1855, she shortened the 2,000-mile supply chain from England by implementing new resources and routines. Lastly, she implemented the germ theory in disease prevention by cleanliness and antisepsis. This was through providing the necessities and emphasizing that it was essential to have clean air, water, and nutrition. In the photo provided, this was her assisting the ill people during the Crimean War. For her major accomplishments, she had a military routine improvement by shortening the 2,000-mile supply chain with the new routines that she implemented in 1855. She also was honored with a brooch by Queen Victoria, where she acknowledged her heroic efforts in 1856. She also established the London's first organizing training school, where it was called the Nightingale Training School for Nurses, in 1860. She also efficiently reduced the death rate by 2.2% in 1855 by providing dietary kitchens and establishing more food that were nutritional and with her own money. And for creativity in nursing, in Paris of 1853, she was trained by the Sisters of Charity, where they carried strict procedures for cleanliness of the environment to decrease disease, infection, and death rates, and dedicated her life to improving hospital conditions and care for patients. She was able to improve hospital conditions and care for patients by providing better food and nutrition that were necessary to heal, as well as ensuring clean procedures were used in order to lessen the chance of disease as well as infections. And Nightingale assisted an army hospital with 3,000 to 4,000 men crammed into a small space with a facility that lacked water, soap, clean clothing, and towels, with a death rate of about 50%. So she took charge of the situation by placing a system for checking regularly on patients and ensuring the cleanliness of the environment. Within 6 months, the lady with the lamp had succeeded in decreasing the death rate to 2.2%. She gained the nickname of the Lady with the Lamp, as she was often seen at night walking with a lamp in order to help those in need, no matter the time of day. This demonstrated her dedication in ensuring a change in providing the help needed. Before Florence Nightingale revolutionized the profession, nursing was not deemed a profession, and many saw that activity as a waste of time. Most people who sought hospital care were those who could not afford private care at home. Hospitals were often considered to be poorhouses, and not much was done to improve their condition. Hospitals were often deemed with situations that lacked the cleanliness that Nightingale was able to provide and exemplify. So she changed the profession of nursing in a way that provided modern care and modern practices. In all three biographies, there is a common factor of the idea that they have a desire to help those who are in need, and they would like to advocate for better conditions in the hospitals, as well as locations that are in poor conditions. Furthermore, they all carry compassion to provide emotional support and care for others, while providing critical thinking in unpredictable environments, causing them to have the ability to be able to adapt to any situation. A similarity that Clara Barton and Florence Nightingale carry is that they both assisted the military on the battleground of their knowledge in assisting the wounded. This may compare to each other's experiences, as Barton experienced challenging and dangerous conditions that caused her to earn the nickname of Angel of the Battlefield, whereas Nightingale was in charge of leading a team of nurses and provided statistical analysis of patient care and providing the quality of assistance. Mary Eliza Mahoney is unique as she was the first Black woman to graduate the nursing program, as well as the fact that she did private nursing instead of public nursing. I believe that nursing is unique to creativity that may not be applicable to other domains by having patient-centered focus by addressing the complex needs of an individual, physically and emotionally. Nurses also need to learn about teaching and patient education as they must explain the medical concepts in a way that is understandable and descriptive. These are the resources I use for Clara Barton. These are for Mary Mahoney's, and these are Florence Nightingale's resources. Thank you.